We're thrilled to have Dr. Lana Choi Alum, research lead at AARP, with us this morning to introduce our first session, highlighting the first of its kind 25-year survey on social connection in America. A big thank you to AARP for your longtime support for this work, including for this convening. Please join me in welcoming Lana to the stage.
Good morning, everyone. My name is Lana Choi Alum, and I am the research lead for our Fun and Fulfillment portfolio at AARP. It's so exciting to see all the partners in the room today who are committed to understanding and strengthening social connections. At AARP, we've been studying social isolation and loneliness over the past decade. And we've learned through the years that social connections is essential to our overall well-being, our overall health at every life stage. And recently, we fielded a study on loneliness among adults age 45 and older, and this builds on previous research that we've done back in 2010 and 2018, and our plan is to release the results at the end of this year. So our goal is to build consistent, comparable measures that communities and organizations can use as they design programs and also as they evaluate what's actually working. We are also working with NORC to update a national map that focuses on social isolation risk. And the data, or the tool, is for policymakers and organizations. It's helping them to identify areas of need down to the state and local and county levels. And it's actually, and it will be accessible through aarp.org. Currently, across disciplines, we are seeing lots of energy around the importance of social connections. But if we want to sustain it, we really need to build reliable, long-term measurement tools. It's an opportunity for us to see how we can build a backbone of data that will guide us for years to come. And so with that, please join me in welcoming Edward Garcia, board secretary and founder for the Foundation for Social Connection, and Dr. Julianne Holt-Lunstad, who's the professor of psychology and neuroscience at Brigham Young University and chair of the Foundation for, or chair of the Scientific Leadership Council. So Julianne, Edward.
Thank you, Lana. I just want to say how thrilled I am to be on the stage today with my dear friend and colleague, Dr. Julianne Holt-Lunstad. Julianne, my colleagues at the Foundation for Social Connection, and all of you who are spending your time through your work, your communities, and your lives to build more socially connected strategies and communities. Since founding the Foundation in 2020 with Julianne and other colleagues, we've seen tremendous momentum around this topic. We've seen the World Health Assembly pass a resolution on social connection just this past May, the launch of the World Health Organization's Commission on Social Connection, of which we've all been intimately involved, the publishing of the Surgeon General's advisory, heightened public awareness, a proliferation of coalitions and movements around this topic, and thousands of individuals taking action on social connection. It's because of the efforts of the Foundation for Social Connection and all of you that all of this momentum is possible. So I just want to take a quick moment of applause to you all and to the Foundation for that. So please join me in that. But with so much momentum comes even bigger opportunity to have an impact at the policy, systems, and environmental structural reform level. But to do that, we need to understand really what people are experiencing around social connection or disconnection in a more consistent and standardized way so that we have the greatest impact for the greatest need. And without trust in where to focus public and private dollars and resources, there's a real lack of confidence on broad population-based approaches to mitigate social isolation, loneliness, and social connection, where people live, work, play, and learn. So the Social Connection in America survey represents something that we've never had before, a commitment to consistent, long-term tracking that won't disappear or change, and one that will give us the detail we need to take action for broad population impact. So with that, Julianne, let's jump in. Okay. So can you give us just a really high brief description of what the survey is?
Absolutely. Before I do, I just want to acknowledge the fact that so many people are here. And that, interestingly, we thought, 8:30 in the morning, no one's going to show up, right?
We didn't want to show up.
But I think it's a testament to just how much we are craving some kind of way to measure all of this, right? And the fact that, so many people are here at this conference and at this session really shows all of your commitment. So again, I just want to applaud you all. So let me tell you a little bit about what we're doing. So to our knowledge, this is the first U.S. national survey to comprehensively measure social connection, not only at the individual level, but at the community level. And so we are going to be, we have nationally representative data that will provide benchmarks that is both at the national level and at the state level and for the next 25 years.
That's really fantastic, and I think what we're interested in is really taking a deeper dive into this. And so the next 20 minutes we'll be doing that. Before we get into the nitty-gritty of the survey itself,
Yeah.
Can you just say, why do we even need this? What problem are we actually solving with this survey?
Yeah, so as most of you probably have experienced, we are in many ways making a lot of headways. And in fact, it's probably no coincidence that we had Lana introduce us, because in some ways, AARP was one of the first to really start to measure loneliness. And we've started to see other kinds of national measurements of loneliness. But unfortunately, what we're seeing is that different surveys are using different measurement tools, and so we don't necessarily have comparable data. Also, we're not necessarily seeing this measured in terms, the timing of these measurements aren't necessarily consistent either. But perhaps also, really importantly, is that loneliness is just, in a way, the symptom. And we can lack social connection in a variety of ways. And so it's really important for us to understand more comprehensively a better picture of why people are feeling lonely, but also all the myriad of ways in which we can feel disconnected.
And we've seen so many proliferation of many tools over the time that we've all been operating. Many of you are using a lot of different tools. So that inconsistency and the lack of the time series of that makes it really possible to think about long-term planning and impact.
Right, and so we need to be able to benchmark and identify trends. And so there has been even a lot of debate on, is loneliness actually increasing or is it stable? If we don't have consistent measures over time, we can't necessarily create these. We also have a harder time knowing whether or not the kinds of changes that are happening in society, whether these are naturally occurring or the kinds of things that are being implemented, to what extent is this having measurable kinds of impacts.
Yeah, that's great. Excited for the tool. So can you dive a little bit further into the actual tool itself? What's actually in the survey that people can know about now?
Yeah, so first off, I want to acknowledge my incredible team. Edna Ishak, why don't you just quick little wave over here. who I had the privilege of working with. She comes from the Office of the Surgeon General. I also am working with Kathy Bress, who was formerly with the CDC. And together we really first wanted to identify what are the core domains that really are essential to this, to ensure that we have the key items. So first, I'll just say we landed on a total of 26 items. There are 12 items that get at individual level connection. There are 9 that look at community level connection. And then we have a few measures of well-being as well. But when we went to look at these core domains, what we wanted to make sure is that this really adequately captured what we know from the scientific evidence has measurable impact on the kinds of outcomes that we care about. So we know, and so we used the framework of structure, function, and quality to ensure we had items that were representative of each of these when we looked at individual level of connection. We also looked at community level connection and the kinds of core elements that are often measured, including things like trust and belonging and social cohesion. And so we really wanted to make sure we had items that represented each of these core domains. And importantly, I want to touch back on the idea that we know that these things, each of these domains is associated with these important health outcomes, community-based outcomes. Interestingly, what we also see from previous research is that they're not necessarily correlated with each other, meaning that if you only measure one of them, you will potentially miss risk from the others. And so that is something that has been lacking in previous studies, is because we're only measuring loneliness, we can potentially miss the risk that is associated with these other kinds of outcomes.
Yeah, absolutely. And I think one of the real powers of this is that this can be used across sectors, right? And so looking at impacts beyond health, beyond our traditional thinking around social isolation and loneliness in that mental health and physical health space, but in many other sectors like education, transportation, housing, economic mobility.
Yeah, we absolutely know that these impact literally every sector of society.
Yeah.
And so we need to make sure that we are measuring this comprehensively. And so this is why I think I'm so excited about being a part of this study, is because we're able to do that.
Yeah. And as we've been talking about, there have been so many efforts in piecemeal, but nothing in this comprehensive approach. Could you talk about the development process and how you actually pulled this together, learn from other efforts, and to build this?
Yeah. So I will mention that we are partnered with Ipsos, one of the most well-respected survey companies, and we did a rigorous process of identifying measures. I will also note that we did not actually newly create any single item. It was critically important for us that we draw on validated measures. So our criteria were they needed to be well validated. They needed to be items that were in the public domain. They needed to, or we prioritized items that were able to get at the core elements or the domain that we were trying to measure with the fewest items, because we know the more items we ask, the more burden it is on participants. And then finally, and not last but not least, is that we prioritized items that would harmonize with other kinds of data sets. So we wanted to make sure we particularly could harmonize with other national data sets and even potentially international data sets. So for instance, items that are being used by in the census or with the OECD, that we can have comparability across these different studies, because that is something that has been lacking for so long.
I'm really glad you brought up that last point. As some of you may know, the OECD has been looking at new measures of GDP, which include well-being measures and things like social connection. There's a whole office, actually, at the OECD looking at this. And so this helps to effectuate some of the global impact they're looking at across those countries, but also the World Health Organization's Commission will be developing a index on social connection that now the 192 countries in the World Health Assembly have all said this is a national priority for their countries. So this helps to effectuate action across that index and across that movement.
Yeah. And I also neglected to mention that this is a probability-based sample. This helps reduce bias and also helps with the generalizability of the sample. So for any of the methodological nerds out there like me, just wanted to make that clarification as well.
That's great. So I'm really interested in the translation of what this means for everyone in the room. It's the point of the Foundation for Social Connection and our Scientific Leadership Council. So let's make this practical for everyone listening. So for the implementers, the funders, the policymakers in the room, how can they actually use this data in their work?
Yeah, and that was the guiding motivation from the beginning, is that this data needs to be able to be used. So, of course, any scientists like myself, data is important just for our own understanding, but we also need to make sure that that data can inform action. And so it was always important for us to make sure that was first and foremost the most important aspect of this. So one of the things I want to make sure is clear is that when this is launched, we are going to make everything open access. And so including the survey tool, as well as after a short embargo period, we are going to make the actual data available publicly for all to use. So how can various people in the room use these? And what I'm also really excited about is that I hope each and every one of you will find a way that you can use this information, whether it is our findings or the actual data itself, that you can use this. So for those of you who are either in the room or I hope nationally, for the implementers, those who are doing interventions or programs or various solutions. What we hope is that this data can serve as a benchmark. And so that as you are doing your own work, that you can compare perhaps the levels within your own work compared to these national benchmarks or even the state level benchmarks. And you can use these validated measures to assess and evaluate your own efforts. For the researchers, we hope that they will take this data and go far beyond any kind of findings that we put in the report, but are able to use this data to refine our understanding because of the so many complex ways in which we can use this data, and perhaps even pair it with other existing data sets out there because of the harmonization. We hope to accelerate the kinds of knowledge that we so desperately need to close some of the gaps that we have in our understanding. And so really creating comparability. For the funders, we hope that this data will help really inform evidence-based funding decisions. How to fund the kinds of things that are actually moving the needle. Also identifying what groups where the needs are most prevalent. Because of the large data set and over time, we should be able to have the data that can help guide some of this decision making. And then for policymakers, so much of our evidence is often on, small samples or particular groups, or it's either a mile wide and an inch deep, or really deep, but very narrow. And so what we hope is that now we will be able to have data not only nationally, but at the state level. And so this isn't just national policymakers, but state level policymakers. That this can guide them in understanding what groups might be most affected, where there might be bright spots also, and where we have opportunities to really capitalize on the strengths of our communities. And particularly, we know that there can be local kinds of efforts, and so we really want to make sure that everyone has access to this data.
Yeah, I love the way this can be used by so many different types of stakeholders and those in the room here. So just long range, big picture, what do you think, if this is sustained for 10, 15, 25 years, what's possible now because of that data?
Yeah, so I think the really important part is that because it's going to be consistent over time, we're going to be able to see shifts in our society. We are going to be able to identify if, for instance, a major policy changes, how is that changing and affecting us socially? If some world event happens, how are we can see how these things shift. Imagine if we had started systematically tracking this prior to various tech interventions, the pandemic, right? If we were able to consistently have this data, we could be able to really look at these in more detail, and be able to look at this even across different generations, because it is so long. We can see those generational potential shifts and how things shift over time. And I see this as so important also in helping us really think about and getting a complete picture of how our nation is doing. You mentioned earlier that we're recognizing that GDP is not necessarily the best or only measure we should be considering when it comes to the success of a country. And we know how critically important social connection is to literally every aspect of our lives, and how it impacts so many outcomes. And this allows us to get a picture of how we're doing as a nation. And hopefully we will be able to align this, not only how we compare to other nations, but how different states are doing as well.
Yeah, what I love about this too is that there's of course the assessment side of this and seeing how we're doing, but I love the part about us being able to take action from this. So understanding what's working, what's not working within government programs or in private sector programs, and being able to plug gaps and have a real national strategy around how we're having impact with research, implementation of programs, policy reforms, and the like.
Yeah, I mean, we know that if you don't measure it,
yeah.
We don't know what's happening, right? You have to measure it to understand it. And in order to know if what you're doing is working, you have to measure it, right? And so, although I know for some people that might sound, measurement might sound really boring, but it is the foundation of what we are doing. And in fact, I will share with you, I've been involved with a joint initiative between the Global Initiative on Loneliness and Connection, which Eddie and I work closely on, with the World Health Organization on the Global Grand Challenges. And so it's the Global Grand Challenges and Social Connection. And as part of that, we asked researchers, policymakers, practitioners, faith-based communities, people representing all sorts of various stakeholders that are all really prioritizing social connection. And one of the leading top priorities that emerged across all of these was measurement. And so it's clear that this is so needed.
Well, it certainly is, and it's very exciting. And before we close out and getting some messages to wrap, I just, what do you have a call to action for this room?
Yes, and so we actually, I think we have if you scan this QR code, you can sign up to get the report when it is launching, and we will be able to send this out to you. But the biggest call to action that I have for you is please use this. I want, and share with others, because I think this will only be as good as it is used. And I imagine that there are probably potential uses that have opportunities even well beyond what we've even contemplated. And I have such hope in all of you. I've seen the kinds of novel and innovative things that people are doing, and this can just be the spark that starts this greater work.
And just, I'm quickly interested, for a show of hands, how do you think, do you all think that you can use this tool in your work? Just a show of hands. So I think we have it right there. So that's excellent. So thank you, Julianne, and thank you all for being part of building the evidence base on social connection.
Thank you.